and have persons home quarantine, you could give them one and teach them how to measure their temperature, and they could do it 2-3 times a day by once they know what to do on one of these.
Okay, Minister.
Some people just in. So the health minister just actually confirmed its 10th case. Well, really and truly, 2 more cases just confirmed. 2 persons tested positive, which raises the total to 10, and a lot more test results to come in after a few more persons were tested, but no results as yet. Some people, according to Christopher Tufton, he made a post on his Instagram story saying that 2 more COVID-19 cases confirmed, 17 tested negative. Kingston, Jamaica, 15th of March 2020. The Minister of Health and Wellness is reporting that 2 new cases of COVID-19 have been confirmed in the island. This is following the result from the National Influenza Centre, where 19 tests were conducted in the last 24 hours. 17 of the cases tested were negative. The country now has a total of 10 confirmed cases. One of the new cases was identified through contact tracing relating to the index case, patient 1, while a second patient presented at hospital with a travel history to Trinidad and Tobago and had symptoms similar to COVID-19. Both persons were isolated and samples collected and tested. The 17 other patients who tested negative, including a person who are from Kingston and St. Andrew, and also Carnanan, who were identified through contact tracing from confirmed cases, where a similar protocol was observed to isolate and test. Up to Sunday, March 14, 2020, 27 patients were in isolation facilities. They remain stable, including patients 1 and 2 who no longer have symptoms. Patients who test results are negative will release shortly. The minister wishes to remind all persons who suspected that they have had exposure to COVID-19 and are displaying symptoms to self-isolate immediately and contact the Ministry of Health and Wellness at 8881-LOVE. You see it? Some people, good news so far. I can't say nothing bad about the government. So you hear? The 2 persons who were the first 2 cases in Jamaica, they have recovered from them symptoms. So there and then people can say it's nothing to be worried about to some extent, you see. And when I say recovered, doesn't necessarily mean say yo them healthy if you go away and things. Them just don't have no more symptoms, whereas coughing, fever and all that. You see, so they're doing well, they're in stable condition, which will give Jamaicans some sense of, belonging, and no more panicking should be, and thing, even though you might never know, people still like a panic. But to me now, me kind of have a sense of hope, because these 2 persons who were the first cases, they are recovering, they are doing great, they are doing excellent. That doesn't necessarily mean it will be the same thing for if me catch it or if you catch it. Is it? But to sure say you watching, them good so far, which we're glad for year and thing as in my people. So we're glad with it. Me not lie, still I'm happy and pleased. The government are certain contingencies that the government are taking to mitigate all of this chaos and epidemic is working. For one, he did that thing to close school as early as possible to prevent any kind of community spread or stuff like that, which we can see right here. So with the second case, which made it to 10, or the 2 cases, one of them are through direct trace or contact. So them do a good work there, so for find the next person who came in contact with patient 0, if see say the person diagnosed with the virus now. So there's a preset. There's not much of a community spread, whereas persons who are in community who have no history of travel to any of the affected country is diagnosed with the virus. Meaning, if me there here, me not gonna away, me not gonna foreign, me just there right here, so and then me just have symptoms, me positive with the virus. Simply means community spread. So that's where the government would have to fret now and see how this happen, how me catch it. That's when the country will be under intensive pressure, and also the health cares as well. So the people, good look so far. Andrew Wellness, the good. These are things that test the government system and see how well persons are doing in the government and all this. This is the time for you guys as government to actually put in the work, because you want to can do. You get me, as some people, and also for the persons, including myself, I love how I actually take this thing serious and now I not laugh. Cause I go store the other day, supermarket, and the people might buy up on food. You see it? I like that. I love that. This is not like when storm are coming and people say, oh, I not buy none, because no storm now come. You see me? have to take precautionary measures much as possible. Is it? And as I say, the government has contingency plans which will actually mitigate the spread or try to curb the virus to some extent. Which even if it peak, you're not gonna see it affect a lot of persons. You get more people. So good news so far. Good news in the 2 first patients. They are in stable condition right now. 2 more new cases, which one were contact trace, who had came in contact with the first patient 0, the first person, the woman that came from UK, and another one who visited Trinidad and Tobago, came into the hospital hill and whatever. A few more tests to come in, and a few more persons who were isolated will be released shortly. Some people there have it. Good news. Nothing to worry about right now until we get some more. Zim people, but make sure I stay safe again. Prayers goes out to my friends, my family, and my loving subscribers and supporters as well. Until next time, just vibes. But one thing, comment how you are doing. Are you ready for this? Just stock up on the goods and thing. One with my people. Until next time, just vibes. I'm out.